Due to a lack of awareness and a lack of infrastructure to support the data collection process, we can't rely on any figure stating how common mental illness is among Pakistanis. However, some statistics by WHO account for mental disorders in Pakistan making up for more than 4% of the total disease burden. Also, it is estimated that 24 million people in Pakistan need psychiatric assistance. But Pakistan only has 0.19 psychiatrists per 100,000 inhabitants, one of the lowest numbers in the world.
So in a place like Pakistan, I feel like the number of therapists and psychiatrists is comparatively very low to more Western democracies and other parts in the world which have taken a more robust approach to mental health as of now.
This is why existing mental health disorders often go untreated, unattended, and overlooked.
This subject, psychiatry or psychology, is not taken very, very seriously by parents here. So they don't really want their children to pursue this. If there were more people pursuing this as a career, as a proper field, because mental health is so important, then I feel that would change.
Stigmas and taboos associated with mental illnesses further exacerbate the issue.
When one person in one family starts taking therapy, it is a stigma initially. I mean, my own aunt had said to me, "Tum pagal ho kya?"
Concerns have often been raised about the government's lack of initiative in devising effective mental health policies.
I know more about UK mental health policy versus Pakistan mental health policy says a lot about the existence and prevalence of the policy in this country.
In recent years, private medical practitioners have significantly raised their fees for therapy and consultation. Patients have felt the impact, with some therapists charging between Rs 7,000 to Rs 10,000 per session. For workers earning meager wages, this is an impossible sum to pay.
I absolutely do think that therapy is something that somebody who's more economically settled can afford. Do I feel like therapists should charge less? It would be like saying that, okay, you charge less, but then you go ahead and you pay for your training. How you support yourself is your problem.
We don't charge much. We have a sliding scale. But like I myself take clients who are at 100 rupees or even less, because we want to give therapy. We want people in Pakistan to have therapy.
Patients are now calling for legislation that ensures affordable mental health services and addresses the skyrocketing costs of medicines.
I wish there was something that the government was doing or making it more mainstream. We advertise everything. Why don't we advertise this?
While organizations like Umang have suicide hotlines and counseling services, much more needs to be done.
There are hotlines for suicide prevention. But truly, how many people are going to reach out? How many people even have that awareness that these things are there? I didn't know. So many young kids who are committing suicide, and it's so important for them to have an outlet, someone who they can speak with, a safe person who is not family and who won't judge them.
People really need this support in an environment where violence, unemployment, extremism, and terrorism can result in severe anxiety, depression, frustration, anger, and fear. Ignoring such issues will only lead to increased cases of addiction and self-harm.
The biggest thing that I would say is that I have so much pride in my heart that you're even listening to this, that you care, that it matters to you to do something about your mental health. And that says so much about the potential and beauty of you and the rest of our community. And I'll tell you that you'll get there. Whatever you're struggling with, you might not feel like it, but you're stronger than whatever is confronting you.